Hello and welcome to the Women's Health Farm. Couple things before we get started. So I have it as part one. This will cover PowerPoints 1 and 2. I would like to make a part 2 that will cover PowerPoints 3 and 4. However, time is kind of a factor here, so I'm not sure if I'll get to it. And then another thing, just because of time, this video is a little bit different. I don't have drawings. I just copied and pasted a bunch of clip art from the internet and made some notes on top of it. So we'll see how it goes. So we'll just start off with talking about oral contraceptives. And so oral contraceptives, they consist of both estrogen and progestin. And so the main type of estrogen that is used is ethinyl estradiol. And so I thought that that looked or sounded like a thin dial, like estradiol, a thin ethinyl, a thin dial stylus, thin looking sundial here. So this picture is going to come up over and over and over with every drug that has a combination of estrogen. So just remember, this is estrogen. If you are doing estrogen therapy, the MOA is that it stimulates the production of RNA and DNA and proteins in estrogen-dependent tissues. So we have RNA and DNA right here. And then adverse effects are breast tenderness, headache, cancer, and thrombosis, which I have pictures to show that a little bit later on to reiterate the adverse effect of that. Now, here are some different types of progestin. So we have, if you know me, you know I like birds. So this type of bird here is called a kestrel. So is this. And kestrel, it kind of sounds similar to the ending of this, gestrel. So we have a kestrel on a lever for levonorgestrel. So that's a type of progestin. Then another type of progestin is norethindrone. So we have these little thin mint cookies and a drone. So a thin mint drone, norethindrone. Another type of progestin is norgestimate, which looks like the word estimate. And then here again is desogestrel. So I have a diesel pump and then a kestrel sitting on top of the diesel pump for desogestrel. And just because I remember, some of these drugs I took from the 524, or whatever the class is, ClinMed, like medication list. And so there might be just a couple extra things in here that were not in our Pharm PowerPoint. So if that's the case, just ignore it. I think this norgestimate was one of them. But continuing on, so you have different types of length of time of oral contraceptives. So you have monophasic. So we have the Monopoly Man from monophasic. And these have, it's a combination of estrogen and progestin, but it is the same amounts throughout the entire time that you take it. And so there's a couple brand names here that are monophasic. You have Yaz and you have Yasmin, which I thought was like Yaz was like Yahtzee. So I have a little dice here. And then this is the less than symbol because the brand name was Alessi or Aless, so just less than. And these drugs are a combination of drospirenone and again estradiol. So drospirenone has the word spire in it, like a church spire, the peak of a church. It's called a spire. Then we have our biphasic. So to help you remember that, I have like bisexual, so biphasic. These have the same amount of estrogen throughout the cycle, but it increases in progestin as I'm sorry I spelled progestin wrong. Anyway, it increases in progestin throughout, like as you go throughout the month. So again, the brand names here are Ortho-Nuvum 1011. So that is a combination of norethindrone and estradiol. So you can see those pictures there. And to help you remember ortho novum 1011, we have like this little symbol of ortho, like bones, MSK, orthopedics. And then this is the Norwegian flag. I don't know, Norway, novum, and then we have 10 and 11. And then another brand name that is biphasic is Epri, and that's a combination of this desogestrel and estradiol. And I thought Epri looked like April. Then we move on to triphasic. So these have changing amounts of estrogen, but the same amount of progestin. And so I have a trident to help you remember triphasic. And again, we have the brand name Orthonuvum, but this time it's called Orthonuvum 777. And so if we have any Friends fans out there, this is Monica, and she is saying 777. Another drug that is triphasic is trifasal. And so that's a combination of the levogestrel and the estradiol. And to help you remember the brand name, these are basil leaves. So 3 basil leaves, tri-basil, trifasal. There is monthly. I do not have that picture included. So I don't think there's anything super important about it, but I'll move on to quarterly, which is where you take the medication for 84 days and then 7 days at half strength. And so that's a combination of, again, the levogestrel, the estradiol, and the brand name is called Seasonal or Seasonique. And so those obviously looks like the 4 seasons. There's 4 season, which also helps you remember that it's quarterly. So here's where we get into the adverse effects of all those drugs that I just covered. So it can take some time to find the right oral contraceptive. If there's too much estrogen, the patient will have nausea, bloating, breast tenderness, hypertension, and headaches. If there is too little estrogen, they might have some breakthrough bleeding and increased spotting, or they might have hypomenorrhea, so just decreased bleeding, decreased menstrual cycles, which is shown by this little tiny blood spot there. If there is too much progestin, then they will have, again, breast tenderness, headache, fatigue, and mood changes. So that's the breast tenderness, headache, fatigue, not the fatigue, sorry, just breast tenderness and headache are really similar to estrogen. And then if there is too little progestin, they will have late breakthrough bleeding. And just to wrap things up, oral contraceptives have a dangerous triad where if the person is over the age of 35, they're overweight and they're a smoker, they're at a huge increased risk for DVTs and PEs and probably should not be on an oral contraceptive. So let's talk about some other types of contraceptives that are not oral. So the first one here is medroxyprogesterone, and that is an IM injection that is given every 3 months. Brand name is Depo-Provera, and so I thought medroxy, I thought that looked like medieval, and then Depo-Provera, I thought kind of looked like Panera, and so we have a medieval Panera, so it's the medieval sign with Panera bread on it. And over here is kind of our MOA. So there are multiple receptors, and the drug works on multiple receptors and affects in the reproductive tract, the bones, the brain, and the heart. And then adverse effects could be abnormal uterine bleeding, breast tenderness, and bone loss. Another type of parental contraceptive is Evra. And so I thought that that looked like Everest. So this is a patch that is worn for 3 weeks and then 1 week off. And it is a combination of estradiol and this norlogestrel. Okay, moving on to some other options. You have the Nuvo ring. So we have a ring here. It's made up of estradiol and estrogestrel. Sorry, etonogestrel. And so etone, I thought sounded like eternity. So we have this like eternal ring. And that is inserted for 3 weeks. It's left in for 3 weeks and then it is taken out and left out for 1 week, and then you can insert a new one. Next are IUDs. So you have Paragard. So here's a guard here, and he's holding the IUD. And this is a copper form. So just imagine that his armor is made of copper. And then the other type of IUD is the hormonal one, which releases the levonorgestrel, which is shown here. And the brand name is Marina. And so I found this picture of like a boat Marina. Another option is Nexplanon. And this is a etonogestrel implant. So again, we have like a tattoo of this eternal ring. And Nexplanon goes in the arm. So I just, found that picture there, kept it simple. And then we have Plan B, which is also this levonorgestrel. And that is taken within 72 hours. And then 12 hours after that, a second dose is taken. You can also have just plain progesterone only. And the brand name for that is Norqd. And this is the form of progesterone, which is norethindrone. And this is only for women who are breastfeeding or cannot take estrogen. Next, we move on to a gel that can be applied vaginally, and this is called Phexxi. Sorry, it's hard to read there, Phexxi. And I just thought that kind of sounded like Pixie, like it has the same ending. Sort of like a little Pixie fairy here. And so this is a lactic acid, a citric acid, and a potassium bitartrate gel. It's going to lower the vaginal pH, which inhibits sperm mobility. And then the adverse effects are vaginal burning, which is shown here, itching, and then UTIs, which is shown right there. So now we'll move on to some drugs for PMS or dysmenorrhea. So the cramps that accompany menstruation are mainly due to prostaglandin imbalance. And so because of that, NSAIDs are going to be your first line because those are prostaglandin antagonists, I believe. And then you can do OCPs if your patient is, of course, wanting to be on an OCP. You can also try B6, nitroglycerin patches, calcium channel blockers, magnesium, a TENS machine, which stands for transcutaneous electrical nerve stimulation, and then exercise. So you can see in the picture, we have NSAIDs, OCPs, B6, exercise, and TENS shown here. I left off the other ones because I ran out of space. And so now I'm just going to talk about drugs that are okay to use in obstetrics. So we have a pregnant lady here to help remind you right in the middle of what's going on. We'll start up here with prenatal vitamins. Obviously, it's important that pregnant people get their prenatal vitamins, but it's very important to get folic acid. So we have a full for folic acid, and that is going to prevent neural tube defects. Next is treatment of hypertension. So if they have acute hypertension, you can use hydralazine. So we have like a hydrant or like a hose for hydralazine. And then we have methyl dopa or aldomet. And so I always thought this sounded like I met Waldo, like where's Waldo? So aldomet. And then if we have chronic hypertension, we can still use hydralazine and aldomet. However, in addition, you can also use a calcium channel blocker, such as verapamil. And just FYI, these are pictures that I used previously. So if you're wondering why I chose these, it's just because that's what I used before. So like verapamil, this is like an aloe vera plant. And then there's more to why there's a pyramid there. But anyway, not important. And then this is a beta fish because you can also use some beta blockers. And then you could also use furosemide, but it's probably not the best option. If your patient's depressed, give them SSRIs. This is my picture that I had previously drew for SSRIs. For induction of labor, you can give oxytocin, which the brand name is Pitocin. So this is a peach pit for Pitocin. Then I have some miso soup for misoprostol. And then a little dino for dinoprostol. And those all help induce labor. If your pregnant patient is in pain, really Tylenol is the only thing you can give them. However, even that should be used with caution. So I just have a bow tie here to remember Tylenol. And you can kind of give NSAIDs, but they might close that ductus arteriosus, so it's not 100% conclusive that it's safe. For diabetes, insulin is your drug of choice. You can also still use metformin, and you can use glyburide. So metformin, this is the Mets baseball metformin. This is a G that is really cold. It's like fur, it's cold, so glyburide. For antibiotics, you can use, and this is just in general, you can use cephalosporins such as ceftriaxone. So this is a ceftriaxone, so cephalosporins. You can use nitrofurantoin, and so the way that I remembered this, if you pronounce the end of this as like nitrofurantoin, I would say if you have a fury in your groin, use nitrofurantoin. And that's because it's drug for UTIs. And then here is a vape pen for penicillins, and that's because in my original drawing I had a hippie who was using a vape pen. So penicillins, and then aminoglycosides are also safe. So again, here's Anakin Skywalker, and he went to the dark side. So aminoglycoside, and also Anakin's on like the drug amikacin, which is a aminoglycoside. So that's why I have Anakin Skywalker here for that. There's some more stuff continued. So if your pregnant patient has asthma, you can use steroids such as fluticasone, so a tick for fluticasone, budesonide, so this is Buddha for budesonide, theophylline, xylophone. I don't know why. There was a reason why I chose that, but it doesn't really make sense in this context. You can use ipratropium, so I thought that that looked like like a person tripping over a rope. I tripped over a rope, ipratropium. And then this is a predator for prednisone. Predator, prednisone. You can all of those can be used in asthma. If your pregnant patient is having some nausea, vomiting, and GI symptoms, you can use compazine. So this is a computer for compazine. This is Ronald Regland for Regland. And these are both brand names. You can also use histamine 2 antagonists, such as cimetidine. and famotidine. And so when I made this, I thought some like this very first word kind of, if you just added an R, it would say crime, and crime you use handcuffs for. So famotidine, and then this one, it's a histamine antagonist, and so it's a snake because snakes hiss. And in my original picture, I had a family of snakes that were dining, so famotidine. And then I don't have a picture of it, but you can also use pyridoxine V6. And then I got kind of lazy here. But if they have allergies, cold, flu, you should use topical or local therapies. You can still use decongestants, steroids, and ipratropium, and antihistamines are okay as well. And then for vaccines, obviously they should not be getting any live vaccines. However, hepatitis is okay. Immunoglobulins is okay. And of course, obviously they're going to get Rogaine. Okay, so now everything else for what I have today is pictures of my previous drawings. So if your patient, so kind of moving on to like menopause, if your patient's having hot flashes, you can give them an SSRI or even an SNRI. So here's just some reminders of what those are. Feel free to stop the video and review the MOAs and AEs that are listed here. Also for hot flashes, you can use gabapentin, which augments GABA, or you can use Lyrica, which also augments GABA. So those are the main two in that picture. You can use oxybutynin or ditropan, and then which is a anticholinergic, if I remember correctly. And then you can also use clonidine, which is an alpha-2 agonist. So just remember clonidine, oxybutynin, Lyrica, gabapentin, and then SSRIs and SNRIs are all for hot flashes. If you have a patient with mastitis, these are the antibiotics that you should use. So nafacillin. So this was a ox who was taking a napacillin. Penicillins, just as a reminder, they bind to PBPs in the cell wall, something like that. You could also use cefazolin. So that's an IV. And then this is clindamycin. Let me go back. So cefazolin is because like it's like a violin. Zolin, violin. And then this is clindamycin. So this was a guy, he was climbing and he slipped. So just remember climbing, clindamycin. And that one inhibits the 50S ribosome. You could also use vancomycin if you suspect MRSA. So that one also binds to PBPs, but it's only for gram-positive organisms. Next, I'll move on to vaginal candidiasis. So candidiasis sounds a lot like Canada, so that's why there's a bunch of Canadian flags to help you remember that this is about candidiasis. So you can use some topical azoles like clotrimazole. So this guy, he was trimming a tree, so clotrimazole. And then, but fluconazole is probably your first line. That's a systemic azole. So fluconazole. So these were a bunch of funguses, and that one has the flu for fluconazole. They inhibit cytochrome P450, both of them. And then they were mentioned in the PowerPoint. They didn't have their MOAs or AEs. We have monostat and then terriconazole, just more antifungals. And then here's a new one, Ibrix Funger. So that sounds really stupid to say. And so I thought it sounded really derpy, like Ibrix Funger. So I have a derpy looking person who's hungry because he's hungry. And then there's a wall here because it inhibits glucan synthase, which reduces the production of cell wall components. Cell wall, there's a wall. Adverse effects are diarrhea, nausea, and abdominal pain. This little derpy dude looks like he would have all of those things. And then another new drug is gentian violet. And so here we have a gentleman who's wearing violet clothing. And this is a antiseptic germicide and has activity against staphylococcus and some yeasts. So it's a topical agent and it can cause local irritation and burning. And just a pro tip is that it must be compounded with other drugs. And then it will also stain your clothing. Okay. Just so some vaginal infections like BV, trichomoniasis, and giardiasis. So here is to help you remember what these drugs are for. Again, you can use clindamycin, metronidazole. So metronidazole inhibits nucleic acid synthesis. Remember, it can't be taken with alcohol. And then a new drug is tinidazole or tinidazole. So this is a picture to show you that it's tiny. And the MOA is that it causes cytotoxicity by damaging protozoal DNA and preventing DNA synthesis. And adverse effects are GI and a metallic taste, which is really similar to metronidazole. And then, again, just to finish up here, I got lazy again. Other infections. So if they have cervicitis, you can use doxycycline or azithromycin. If they have pelvic inflammatory disease, you can use ceftriaxone plus doxycycline plus metronidazole or ampicillin sulbactam plus doxycycline. If they have endometritis, you can use clindamycin plus gentamicin or ceftriaxone plus metronidazole or ampicillin sulbactam. So that is all I have for you today. I apologize for my less than enthusiastic presentation, and hopefully I can make a part 2 soon. Thank you for watching.